Hi students, welcome back to the CF program. You're going to the second semester clinicals. Congratulations, we appreciate that. But there's some things I'm going to go over with you now to kind of help you out as you go through your second semester clinicals. And definitely want you paying attention to this. Very important, some of the things that we're going to go over. So first things first, if I can get the slides to advance here. There we go. So we're going to again review what we're supposed to do and what's different second semester versus first semester, and the different types of clinicals. That's kind of the really thing I'm going to be focusing on. And we're going to talk about putting things in the Platinum Planner that maybe will help you to get done with all those formative and competency requirements that you're going to have. Remember, we're gunning for that 100%. And this semester, we're going to put a big dent in that, okay? So some general rules to remind you about. Rule number one, you should know about all these things before we talk about it. And make sure you park in the right spot. Get there about 15 minutes early. When you come in, introduce yourself to the staff. Tell them who you are, where you're from. Tell them that you're a paramedic intern. And if you haven't learned any by now, hopefully be nice. You'll be surprised if you're nice and you're helpful, how they will absolutely go a lot farther to get you great interactions with the patients, okay? I can't stress that enough. If you come in with a bad attitude, looking horrible, I'm usually end up with a phone call, and of course we don't want to do phone calls. All right, so this semester we got 50 hours to do in the emergency room, but then we've got some observational clinicals, and I'm going to go over those specifically when we get to them. But you're going to do 4 hours in the NICU. You're going to do 10 hours in OB. You're going to do 4 hours in the cardiac cath lab. These are observational clinicals only, and we'll go into those. You're going to do 12 hours on a non-transport unit, whether that be the Citrus County Fire or Ocala Fire. And then you're going to do, again, 20 hours in the pediatric emergency room, and there's some very special things that you need to do when you get to there. And then finally, we're going to get to some ride time. I know everybody's been biting at the bit. Get on the ambulance, okay? And one more is, if it is open, and lately it hasn't been open to us, but we're working on it, you're going to get a chance to go to the cardiovascular operating room, and I'll go over that here in just a second. But our general goals, remember, we got to get 50 patients this semester, but I reiterate to you all, more is better. Please get more. Please, please, please get more. If you have the opportunity to knock out one of those assessments like on OB or a psychiatric patient or a stroke or a seizure or some sort of cardiac condition, guys, knock these out. You have to know in your report where you stand. So run your report before you get to clinical, see what things you need, and try to focus on the things that you need, okay? So again, but when you get to the pediatrics, and this is the really important part, you're going to be doing assessments in pediatrics, and a lot of them, okay? You've got to get 30 pediatric assessments before you finish the program. Since only 10% of our calls are traditionally, once you get to the ambulance, they are pediatric patients, you're probably not going to have that many. And I would say here it's even less than that, because we live in big retirement communities where they don't have a lot of kids. And those kids, if they are there, they usually don't get sick. So again, I stress to you, get your pediatric patients. Now, the 3 places you can get that is when you go to the NICU. If you go to OB, guess what? If they have a baby, that becomes a neonate. And so if you get to assess that neonate, there you go. You've knocked out another patient, all right? So yes, if the lady delivers and you're able to assess her, and then you're also able to assess the baby, congratulations. And then the big one you're going to get all these things is in the pediatric ER, okay? You're going to be doing assessments, more assessments. And again, you're probably going to get writer's cramp from that. We understand that. But also, if you focus in and do those during the pediatric ER, that's less patients that you actually have to do. All right. So, and again, get your OB patients completed. Hopefully, you got a few of these in the emergency room when you're there. But if not, definitely we're trying to get these goals accomplished. Now, the emergency room clinicals. Hey, we now are learning EKGs. This is what we do in second semester, cardiology. And so you need to start working on getting EKGs of these patients. Again, in first semester, yeah, you got an EKG, but you didn't know what it said. Now you're starting to learn what they said. So again, guys, make sure you get your EKGs, again, formative, and then get your competency, okay? Remember, we document formative. That means we're still learning it. Competency means I can identify it, okay? Even if you identify the formative first, you got to get all those formative done first, okay? And again, document strange rhythms, by the way, and make sure that you make sure that there are no names if you document somebody. So in other words, if you get a strip, you're going to take a picture of that, but make sure that there's no names on it, okay? You're going to upload that strip with your thing in Platinum Planner, okay? Now, get assessments on your cardiac and respiratory patients, obviously. But again, and then make sure that you've looked at your report to see how many of these you guys need, all right? 10-hour shifts, again, same rules as before. The first 8 hours, you're going to do things. The last 2 hours is for your documentation, but however, if they need you, let's say the code comes in or somebody in VTAC comes in, that might be one of those you want to get up and go check out and then come back and finish your documentation, okay? So again, try to finish up your documentation before you leave the clinical, okay? Try to get that stuff done. Now, when you get to the pediatric ER, the same rules apply, but again, we're going to focus on our assessments. Now, here's one of the things about Platinum you need to know about. It will tell you how many of each age group that you have. And if you don't know your age groups, this is a good time to go back to your earlier chapters to figure out what's a toddler, what's an infant, what's an adolescent, what's a school age, what is a neonate. All of these you need to be able to easily identify, okay? So there's 6 groups of those, all right? And you got to have 15 formative, 15 competency. Okay, so get your formatives done first and then your competency. But the problem is you're going to have to really look at how many formatives you have and how many competencies you have. Okay, you need, I would say, try to get 2 of each age group to be sure. But make sure that you take a good look at those, all right? Because there's lots of times we have to go back and then change things that you put in as formative, change it to competency or vice versa. So keep a track of that when you're running your report, all right? You're probably not going to have as many procedures there, okay? If they let you do procedures, great, that's wonderful, as long as it's in our scope of practice, absolutely. But I want you to really focus on, while you're there, assessments, all right? So can you do procedures? Yeah, but you're probably not going to be doing as many as you did in the ER, so keep that in mind. And there are 30 pediatric patients. All am I going to do is yes, and you're going to do a lot of reports. So I'm forewarning you ahead of time. Yeah, you're gonna do some typing when you get to this clinical, guys. But again, we got to get 30 of them, and unless we do a third clinical, by the way, if you don't get all 30 of them, you're probably going to have to end up doing another clinical, maybe at the start of 3rd semester. So just so that we make sure that you guys get that, and that's kind of a freebie. That's extra time that you have to spend. We don't want to do that. So while you're there, focus on getting those assessments done. All right. Again, just to recap, assessment, get your assessments, get your age groups, focus on that, gang. Again, sometimes we don't get the choice of what age gets to come in. So especially when you're doing a regular ER, if you see a kid come in, even a teenager, a school age child, you need to be trying to run over there and grab those. Okay. All right. Now, the nice way of saying, the way that Platinum looks at your non-transport rides, we call it medical first response. Okay, so that's the way that they classify it. So we kind of that's the Ocala Fire guys, that's the Citrus Fire engines that you guys are getting to ride with those. Again, for those patients, you don't have to transport to get credit. Okay, so you need to document everything, and that includes if you go and get a refusal, you need to document the refusal as well, okay? And it's some good practice for you to do that as well. And unfortunately, I hate to say this, a lot of times the medical first response guys, they get there, they help out a little bit. But again, this is where you have to kind of transcend that. If you didn't go in and you didn't do anything, you don't have to put anything because you didn't do anything. But then you don't get credit for that. So get that chance as you can to do your patients and get that count down. Now, when you go to the cath lab, this is an observational clinical, all right? So the way it usually works, you go in and you get assigned one patient, and then you're going to go through their prep, and then you're going to go into the lab. They're going to show you the things that they do in the lab. Then they're going to come out into recovery, okay? So, by the way, this is a really good time while the nurse is doing her assessment. Maybe you get your assessment in as well. And again, we get a lot of questions about this one. Do I have to do a patient encounter? If there was ever a perfect time to do this nice, controlled, easy, get to talk to your patient, yeah, this is it, okay? But what if I get 2 or more patients? Hey, guess what? You get 2 or more credits. So if you get that chance, please do that, all right? And can I start an IV? If they let you, absolutely, please feel free to do so. Just remember, in this clinical, you're doing a lot more watching and learning, okay? So keep that in mind. Whatever you do, by the way, don't video anything in the cath lab. I speak only from the horror stories that I told you guys, hopefully, in first semester about recording while on a clinical is the devil. Okay, now, CVOR. Every now and then we get to go to the cardiovascular operating room. Guys, this is usually a gold mine for getting intubations. But remember, the same rules that apply in the OR also apply in CVOR. We got to remain sterile. Everything's sterile. We want it to be sterile. These people's chests are going to be opened up. We really don't need to be doing anything in there, okay? But again, they usually will let you, like I said, intubate. If they let you intubate, man, go for it. But this, by the way, in this clinical, really, this is a good time to watch and learn, okay? I've had students holding retractors so that they could actually, the doctor let them do that. So, again, if they let you do that, it's great. If they don't let you do it, it's okay, all right? But, again, you need to be there. 6 a.m. is usually the start time. You need to be there at 6 a.m., okay? I cannot stress that enough. If you say, well, I'm coming off a shift, don't schedule it on the day you're coming off a shift, period. All right, please don't do that. All right, you go to OB. Guys, this is an observational clinical as well. Please do not push this. I know that you're used to going to the emergency room where you start the IVs, you do all this. And if they offer to let you do that, by all means, take that opportunity. But I will also let you know that usually they don't in this clinical, okay? So some patients, again, they might say no. They say, hey, we don't want you in the room. That's okay. It's perfectly okay. All right? So if they say that, don't take offense to it. Again, this is a very personal time for the ladies, so we definitely want to abide by their wishes. But again, when you do get in there, watch and learn, and please be discreet. Be a professional, again. But if the doctors are going to let you watch or they're pointing out some things that you need to do, absolutely do that. If the doctors actually let you do stuff, I've had docs actually come in there and go, here, you deliver the kid, okay? And you know what? If they are going to let you do that, there is no better time to let you do that, okay? By the way, so if they do deliver a baby, that is a neonate patient. So you get an OB patient and a neonate patient. Yahtzee. Okay, you got it. So that's what we want to do. All right. All right. So again, if the team's not letting you do anything, can I leave? The answer is very no, because you never know when somebody's going to have a baby and they're going to come in, and then there you go. Can I go to the OR area of OB? If they let you, sure. We had one student just recently got a triple neutral cord, and they had to take it by a C-section, and he got to be in there and actually see all that. So again, but this is a good time, again, keep your eyes open, your ears open, your mouth shut, okay? And that's just a simple, just try to stay out of their way, okay? If I'm going to sit in the corner and do nothing, this is a great time, again, to bring your books. So, yes, you're going to have a lot of downtime during this time. So, guys, please, use that time wisely to get some studying. And remember, guys, there is an OB checklist. Hopefully your instructor will give that to you. It's just some things that need to go through about the OB area. But I'm telling you right now, guys, this is an observational clinical. And please don't try to do everything. Again, this is a good time to sit back and watch and learn, okay? And same thing with the NICU. We're probably not going to be doing procedures up there. But boy, this is a great time to talk to people that assess babies all the time, okay? I got a little skin in this game. My daughter is a NICU nurse down at Winnie Palmer. And so very proud of her, and I'm trying to get her to come up here to do some teaching for you guys. But again, it's more observational, but again, we let them teach you how to properly assess a neonate. Just remember, their immune systems aren't built up too well, so you need to, again, don't show up to these places sick. Make sure that you're ready to go when you get there, and be ready to learn how to do this properly, because it's going to be just you, and probably only you, that's going to have any experience with doing anything with a neonate when you get out there in the real life. At long last, we have come to ride time. And I would recommend that you save this towards the end of your second semester. All right. This is the good time to scope out potential preceptors. Okay. Go find that person that fits kind of with you, the area that you might like to ride in. So again, this is a good time to shop around. Now, one little note on that. CF, we reserve the right to put you with any preceptor based on your need. But again, we're not heartless. We try to put you with somebody we know you're going to learn from, somebody that's going to be good for you. Okay. So don't get upset if we don't, 10 people ask for the same preceptor, which commonly happens, unfortunately. So, again, but if we know that you need a little bit more help, if you need to be with a little more stern paramedic versus somebody who's just going to hang back and let you do things, we're going to put you with the person that you need. Okay. Now, you've got 7 of these shifts. They're 84 hours. We actually moved one of the non-transport rides to a transport ride. So, hey, you get some good quality time on the ambulances. Now, during this phase, you are allowed to document refusals as patients. Okay. I want to stress this, second semester, because when we get to third semester, that rule's out the window, and I'll explain why once we get to that point. All right, so that's it for this video. Again, some different things that you're going to be going to. I wanted to share that with you. If you've got any questions need to go to either 1, your lead instructor, 2, your clinical coordinator, or 3, then you can bring it to me. Okay, but make sure you follow that path. Start with your teacher. I can't stress that enough. Start with your lead. Okay, and then again, good luck. I hope this was helpful, and I'll see you guys next time.